Introduce ourselves first. My name is Sivulo Niratu and I'm from Fiji in the Pacific.
Mabuhay. Good afternoon, everyone. I'm Art from Philippines. Well, I'm an adolescent child reproductive health advocate, trainer, also working with MSM and TG, Butterfly Brigade.
Thank you. Before we go into our presentation, I'd just like to give us very briefly on what the health and welfare group we were tasked with. We were tasked to identify key issues on health and welfare pertaining to MSM and TG in the region. So there were a lot of issues which were identified under this broad category, but we try to be very specific, so we have to identify priority issues which we thought we would come up with key recommendations. So we will focus on three key issues. The first one is we will talk about access to health and welfare services, whereby MSM and TG are not able to access these services because of stigma and discrimination, and perhaps due to attitude of healthcare workers and medical professionals or in service providers within the region. And the second one, which is on policy, lack of involvement of young MSM and TG in policy development pertaining to health and welfare services. And the third one will be on coordination on health and welfare services which target MSM and TG. Thank you.
Alright guys, so we prepared our presentation and now the recommendation that we can start with when after this consultation. First, we have the training for healthcare workers in collaboration with Ministry of Health on MSM TG issues. Potential partners, so we have the Department of Health, World Health Organization, United Nations, USAID, AUSAID, local government, existing CBO conducting MSM TG works. So we are expecting to get this network with them, or to get like to request for funds or any help that they can expend in a span of 1 year. So first, on how we can do that, we have an initial period, like we need to identify the stakeholders and resources where we can tap together in order to reach the goal that we are expecting, like to get funding, and also how we can start the activity and program. Consultation and validation, also design phase. So for 3 months, we need to develop modules and what we're going to use during trainings and seminars, as well as for the TOTs. Implementation phase, mobilization of National AIDS Authority. Also, hospitals and healthcare providers are sensitized. The training module is introduced. So first, we need to gather to get trainers for on this one. So as we have, like you can see there, consultation with MOE and stakeholders through NACA, bit of research and best practices from other countries. And well, example of this is the practice that we have in the Philippines for STI HIV/AIDS prevention. I work for UNFPA in the province of Baclan as a technical working group. We do, like for HIV cases, we do projects on how youths, MSM and TGs can get involved on the program and to get access to services for free. So I've shared that also to my fellow people from Myanmar, Fiji, and Cambodia. Alright, so policy. So working on a policy agenda to ensure that health programs for young people in general are supported politically and financially by leaders in the community. While this is youth in general, we will also work in improving MSM, TG standing in the communities with an active involvement in the advocacy for the youth. We need also to be a part of the national network of MSM TG in Southeast Asia and Pacific countries doing advocacy work in the area of RH, including STI, HIV/AIDS, and also human rights advocacy. Time frame, we are expecting for 1 year. Methodology, sending requests to relevant ministries. Like in Myanmar, their #1 funding agency is USAID. Also in the Philippines, we have like UN funding and other like from other Asian countries who support STI, HIV/AIDS, and reproductive health program. In Bangkok, I believe that they have a lot of funding agencies. So coordination. This is the last slide. Maintaining of regular communication with service provider. So like we have focal person from each country, which we have representing the health and welfare from Myanmar and other friends here, delegation from different Southeast Asia and the Pacific. So we will have like a networking team will also tackle that. So we don't want to dig into issues. So next one is updating them on the issues faced by MSM and TG. So even me, I don't know right now. I just realized how TG is affected in issues and stigma and discrimination because me, I haven't tried to think of cross-dressing. So I want to be handsome. I want to be cool. So I'm a bisexual. I'm gay. So but I really don't know what is theirs like what is happening to them. So we really need to communicate for each other first in our local area, next at national level, and we can go with other Asian countries. So challenges. The utilization and gathering of data from different organizations. So we need to overcome the challenges. First is, this is a great help with Mr. Stav from Nepal, representing Bangkok. Well, coordinating with youth lead. So in the Philippines, we have Organization for Youth. Also, I believe that they already participated here in like in Pattaya. We have just recently. We have Wayne here, also from the Philippines, representing UNFPA. So we need them for data collection, networking, sharing of issues and information. So we are expecting to get data in 6 months. I hope they will not lose our email addresses. So all processes will be youth lead with support from existing organizations, what we have in our local area, what we have in our country. I know that they are working separately to get the goal. That me, I'm experiencing, and also in the Philippines, and my other friends from other countries experience the same thing. Like we have a lot of funding agencies, we have a lot of services, but they're working on their own. They are not connected, they are not team to work together to get the goal. If you go to UNFPA, they have different data. If you go to the Department of Health, they have a different data. So I don't know how they work on that. Maybe we are in the position as Voice for the Youth. At least we can have them convene if possible. So great wish from the Health and Welfare Group. Thank you.